Welcome, everyone, to our Wednesday webinar for our patients. Tonight, we have a special guest who also the executive director of the IABDM. You probably hear about the IABDM every single webinar as a current president of the IBDM. We know this is like a public service, educations for the public about the hidden infections in the mouth. But today, we have Dr. Don Ewing, who's going to give us so much knowledge about Meridian, especially dental Meridian, because this is what we're doing and checking every day at our office for biocompatibility. And especially what Dr. Don doing is something that we do in surgery and also the whole body evaluations, ability that we can connect the body and the mouth. So Dr. Don, no further, I know you're very famous. If you've seen the movie Root Cause, you will recognize her. Your hair is almost that length in that
Yeah,
movie.
almost now, yeah.
Yeah. Yes. And of course, a few housekeeping. Please have questions. This is social learning. So people learning from your questions. And Dr. Don and I will stay until the very end to answer all your questions. And then also, we will put the website of the IABDM.org on there. There's so much resource for the public. Also, listing for certified biological dentists on there. And then make sure that you pay attention fully. This is not something you just tune in for a little bit and you're not going to be able to learn the connections and answer the questions. So go ahead and take out your pens and paper, turn on your camera, but mute if you are on here when she's presenting. And let's learn together. Thank you, Dr. Don. Take it away.
Hey guys, I'm super excited about this because most of you that know me or have ever heard me before, I try to speak in word pictures. So I take all those really difficult concepts and put them in terminology and concepts that you can understand, that you've probably worked with points in your life. So I'm going to try to do that with the meridians as well. Now, when I first heard about meridians, the only meridians I'd ever heard about were on the earth. And we're not talking about those. We're not trying to figure out a position on the planet. These are way different. But yes, in the English language, we use similar words that can mean two totally opposite things. So, what exactly is a meridian? The meridians in the body, they're energetic highways. Now, depending on where you are, we might call it chi, or just saying that the energy flows through that meridian. But I want you to think of it as a type of a freeway or a highway. And this freeway and highways, they connect different parts of the body together. And you're going to see that as we go further. You know what's interesting to me is that most every other culture or country completely understands that. It's just here in the United States, we've been conditioned that this doesn't exist. But if you grew up in China or India or Japan or even in the mountains of Tibet, then you understand that there are these energy channels through which the vital energy flows, and that when they're out of balance, that's when illness sets up. So it's all about attaining the balance in the energies. When I say balance, everything has a light and a dark. So if you've ever seen that emblem that's black and white, that people will say it's the yin and the yang, or you're the yin to my yang, or however that goes, you're looking for perfect balance. So the example I tried to give you is, unless you're in a desert somewhere, most plants will need water as well as needing days that are dry so that they can thrive. So it's all about the balance between being dry and having enough water. For Americans, when I first started teaching this at Capital University, of course, I was teaching to students that were already doctors of some kind. And they put up walls and barriers going, no, this stuff doesn't exist. So I had to really dig to find references to prove that this is not woo woo medicine. So Dr. Kim Bon Han was one of the first people to demonstrate that the meridians exist. And what he did was he injected a radioisotope into an acupuncture point and then started taking images to show that it wasn't going up an artery, it wasn't going up a vein, it wasn't going up a nerve, it was actually going up the meridian. And then it was reconfirmed by another doctor. Similarly, if I were to take a car and I took the battery out, that car wouldn't run. A human body can't run without electricity. We are electric, and that becomes a focus for what we're talking about. I remember when I was teaching a physician about the meridians, and he said, "This is ridiculous. I just don't believe it exists. I need to see in cadaver lab, where are the meridians?" And so you won't be able to see them, just like you wouldn't be able to do an EKG on a corpse. You can't, because the battery's gone. The life force is completely gone. Therefore, I can't do an EKG or an EEG or any other type of electrical test because there's nothing to conduct. What you have to focus on, and this is something you might want to write down, is that this concept of the energy flowing through the meridian is invisible, not imaginary, and it is measurable. So the example I wanted to give you is that all of you, no matter where you are sitting, are breathing 21% oxygen and 78% nitrogen. But you can't see it, not unless you're in a real smoky room, and then your numbers are not going to be exactly what I quoted. So imagine that if this energy is flowing through our body and all of a sudden there's either a short or a complete blockage, what would happen? And so that's what we're going to try to investigate. This is a concept. So I want you to think of this as the sprinkler in your yard. You see, I have a custard and a gallbladder and a liver and an eye, because those are all on the same meridian. So imagine that all of a sudden there is a blockage somewhere in that sprinkler line. Let's say it's between the cuspid and the gallbladder. All of a sudden, the gallbladder, the liver, and the eye are not going to be getting as much water. So you can start to understand what we mean by a blockage and how it might affect that meridian. You could also think of this as a soaker hose. A soaker hose has water that comes out all along the hose. And if I laid it out and I had 8 different plants along the stretch that I've taken this hose, and I put my husband and have him stand on that hose, everything downstream, the water shuts off. Now I can push him off and have him get on another spot. And again, it will compromise. So there are some blockages that jump on and jump off, or that are temporary, and we can unblock. Imagine what happens with a lamp. Again, another concept. The lamp turns on if it's working. If I buy a brand new lamp at Walmart, I am assuming that lamp works because it's brand new. But if it's short in the wire, when I get home, maybe it doesn't work at all. And if someone cuts the wire, it's absolutely not going to work, because the electricity can't jump the gap of where there's no wire. It requires the wire in an effort to get that electricity to flow. You could think of it as a circuit in your house. And I use this analogy all the time. So this is the one we're going to stick with for just a second. If I have a dishwasher that for some reason is not working today, but yesterday it worked just fine, you need to know that I'm in about a 2-year-old house now, and I have GE appliances. I used to have a Bosch dishwasher, which I really liked because it's nice and quiet. So now that my dishwasher is not working, I'm impulsive. So I'm already on the internet and I've found my new Bosch dishwasher. But my husband walks in the room and says, well, do not push that button to order it. Let me go out and see if the breaker box has tripped. But it didn't. And that's it. That's all he knows about electricity. So he hires an electrician to install my new dishwasher. When the guy gets there, he says, let me check out a few things before you open that box. No, I know I want this Bosch dishwasher. So I open the box and I tell him, just install it. But when he does, it doesn't work. Now I'm frustrated because I think I got the only dishwasher in the entire store that doesn't work. But in fact, he starts checking out the rest of that circuit and finds out that a mouse has nibbled a hole in the wiring. Now, see, what you need to know is if that mouse nibbled a hole in the wiring in two spots, you would have to splice both spots in order for that electricity to flow. Your body is connected like old time Christmas lights. When I grew up, if the Christmas lights didn't come on that strand of lights, you had a couple of good bulbs. You take out a bulb, put the good bulb in, see if that made it light up. Go to the next bulb, take out the bulb, put the good bulb in. You would test out each bulb and you would pray you only had one bulb that was out. Otherwise, you just had to go get new bulbs and put them in there in order to get it to light up. I tell you that because oftentimes somebody will have two electrical disconnects on a meridian and they want to know which one do I have to repair. And so I need you to understand it's not which one, it's that you have to repair both in order to get that electricity to flow on the meridian. Okay, this is the analogy that I just gave. The little mouse nibbles a hole in two different spots, but you cannot just slice one and expect good results. It's just not going to happen. You can have a dysfunctional organ. So let's maybe say a thyroid that could reduce the energy going not only to the teeth that are on that meridian, but the other organs that are on that meridian. A breast, a stomach, a pancreas, a spleen. Or you could have a tooth be the blockage and reduce the energy not only going to the other teeth on that meridian, but to the organs related to that meridian as well. So it is a two-way street. You need to think of it as a complete circle, and anywhere on there, if you have a blockage, that will reduce the amount of energy going to the other things that are depending on that energy. I want you to think of it as a freeway where everybody is going the speed limit. Nobody has slowed down, nobody is stopped, and there are no traffic jams at all. Everybody's just going a steady speed. That would be a healthy meridian. That's the way it's supposed to be. But sometimes things block it. Now, in this instance, if you're in Texas, you could be on a country road and all of a sudden you can't go anywhere because there's a herd of cows there. That's a temporary blockage. Or you could be someplace where a bad storm comes through and knocks a tree over, and you can obviously see that you cannot use this road. But it is not permanent, it's temporary, and they can be taken care of. So sometimes we might find an issue that is really easy to deal with, and then the energy starts flowing on that meridian again. But there are some things that are way more difficult, and you should not be trying to do them yourselves. As the example here, if there's a down power line, you're going to have the experts come in and take care of that. And you're not even going to be like this guy standing on the side of the road. You're going to be way, way away from any of this. And so my analogy there is there are some things, for example, an area in a jaw that is dead or a dead tooth, i.e., a root canal, that you can't deal with yourself. You're going to have to call in the professionals to take care of that. Here's another really good example, because sometimes people have this concept that if the meridian has been tampered with, i.e., a root canal is done, that disconnects the meridian, which it does, but it's fixable. It's like this picture that I have, that here's Houston and the freeways are underwater. But again, it's a temporary blockage. If I had a magical vacuum and I could suck the water off of that freeway, instantly it would be usable because the body is designed to heal itself. So when a tooth is removed, because that tooth was the blockage if it's a root canal, if all of the dead bone is removed, instantly that reconnects. The example I want to give you is you are the electrician that is fixing that disconnected wire that I showed you by the lamp. In order to fix that, you must move the wires closer together. No, you have to remove all of the airspace and make those wires touch. When you do that, instantly the light comes on. And that's the way your body is. It's designed to heal itself. You cut your finger, you don't have to go to an encyclopedia to look up the clotting cascade and tell your body, okay, send it over to my left index finger. I need platelets over there because that's where I cut myself. You don't have to do any of that. Your body's designed to take care of itself. As soon as you reconnect the meridian by removing all of the dead stuff that's in there, the electricity starts to flow on there. And that's the amazing part with all of this. And a lot of people want to know, how would I know that there was anything going on? That's where these bioenergetic devices come in. These are devices that measure the body's response to different things. It would be an EKG or an EEG or an EMG measuring your muscle. We in energy say that everything starts with the process of energy. If I touch a hot burner, there is an energetic message that goes to my brain first to elicit the response of making me jerk my finger away. So it starts with electricity before the chemistry starts. I cut my finger, an electrical message is sent to my brain to start the chemistry of the clotting cascade. So energy always comes first. When we're talking about dental meridians, this is the chart that you will see often. When I first learned about this, I just rolled my eyes and went, I didn't learn any of this in school. There is no magical string that connects a liver to an eye to a cuspid. I just have never heard of that. In acupuncture, they don't teach this. Although we say these are acupuncture points and acupuncture meridians, they are. It's the Germans that took the acupuncture technology and advanced it to connect the teeth. If you were to go to your acupuncturist and ask them something and they didn't know, that might be the reason why. I just wanted you to know. But when I was first learning this, my frustration was I would memorize everything that was on tooth number 1, which is your upper right wisdom tooth. And coincidentally, it's on the same meridian for the lower molar. I thought they all wind up like that. By the time I got to the 2 molars on top and I memorized them and then jumped down to the 2 molars on the bottom, that's where I constantly got stuck. And I was super frustrated. I ended up taking a bunch of index cards and writing on there everything that was there. And that's when I could see that the green meridian doesn't line up with the blue molars on the bottom. They're on a different meridian. The meridian actually makes a little bit of a zigzag. All the rest of the teeth are on similar meridians. So this is why I got stuck there. All those front teeth are all on the yellow. And the only reason they are yellow is because when I was creating this, I realized I do better if I color code things. All of those front teeth have to do with kidney, bladder, and what do those make? It makes urine, and healthy urine is yellow. So I made it yellow. And the only reason the purple is there has nothing to do with anything about LSU. It's just that it was a contrasting color. So I put the purple there. Then everything else just kind of randomly fell in place. But you really could see how the crisscross happens. This is how I feel. I feel like when I am looking in someone's mouth, I'm instantly gathering data and going, okay, isn't it interesting that all of their fillings are all on the same meridian? What it's more than interesting, and it's not coincidental. Your body had a blockage, and those teeth didn't get enough energy to be able to fight off the acids that every other tooth in your mouth was doing just fine with. So let's talk about some things that can block the meridians that have to do with dentistry. Root canals. Now, if I talk to a dentist, they will admit that root canals can reabscess, and for them, it's a bacterial issue. It would be sending the person to an endodontist to have the tooth retreated to reduce the bacteria, which is fine, but that's not the problem. The problem is an electrical one. I took the wiring out of the lamp. Now, if a dog comes by and poops on the cord, it doesn't smell good and it's not pleasant and it's not healthy. I can clean that up and I can sanitize that area, but that's not going to make the light turn back on because it's an electrical issue. So for me, that is the issue. Do I acknowledge that a lot of people cannot tolerate the bacteria that is found in those root canals? Yes. Do I acknowledge that bacteria and the waste products from those bacteria can reduce the body's ATP, the adenosine triphosphate, which translates to fatigue? Yes, I acknowledge that as well. But the real issue is still the electrical issue. Then we get to implants. Those could be an issue if you're having an implant done and it's titanium. That's a metal, and it would be like sticking a fork in an electrical outlet and bending that fork and sticking it in the bottom, and it would short out that electrical circuit. The zirconia is a porcelain, and it creates a much smaller burden. It is impossible for electricity to go through porcelain. And we've proven that, and we've shown that to our doctors by doing this fun little thing to show them that you can't get electricity to go through a porcelain mug. But it only blocks one lane versus blocking all of the lanes on that meridian. And most of the teeth have 8 teeth, 8 lanes on a freeway, if you will, on that meridian. So if I put an implant in one, I run the risk of diminishing the amount of energy going to the other organs by 12.5%, which is really not very much, versus putting a titanium implant in and risking blocking 100%. Extraction sites that didn't heal can create an electrical issue as well because it becomes a break in the wire. And sometimes when I'm testing them, I will even use the phrase, this is not so much a disconnect, but a short in the wiring because I can get some electricity to go through, but not like I want it to. And those areas, if they're cleaned out, that immediately removes the barrier. Think of it as me standing on one side of a wooden wall, you standing on the other, and I have an extension cord that's plugged in, ready to go. And you have a strand of Christmas lights where all the bulbs work, and we're trying to get to each other, but we can't because that wooden wall is in the way. If somebody comes by and starts sanding the wall, they will have to get all the way through that wood in order for us to connect. So the moment that extraction site is cleaned out, then the electricity can go through there again. And another thing that we see in dentistry a fair amount is that when metal crosses the midline, so that might be a partial, or the time I see it the most is people who have retainers on their lower front teeth after having orthodontics. And sometimes that creates a problem, not only because those teeth can't move and your teeth are naturally designed to have an ebb and flow with that in craniosacral work. There's a little bit of ebb and flow. You might notice that some days you try to floss 2 teeth and they're super tight and you can't get the floss in between there. Whereas another day you floss that same area and the floss just falls right in there. That is the body's natural ebb and flow and the ability of those teeth to shift as needed. When you have a retainer on, that inhibits or prevents any movement whatsoever. Those particular teeth are on the kidney and the bladder and the ovary, the uterus. They're also on the adrenals. And that is the organ that I seem to pick up the most that is compromised. Not always, but often. But things that block the organs are also important. So we have to look at nutrition and digestion and all these other things that could be a problem. For instance, during COVID, I still saw patients, but I started seeing more and more women coming in with poor readings on molars that were on the top. And when I'd go through and try to find out what the issue was, it would stop at breast. And I was really confused. And all of a sudden, on one person, I said, "Do me a favor, disconnect your bra." And when she did, I was able to retest, and the reading was much better. What happened was a lot of women gained weight during COVID because they were at home and they were cooking more and they were trying to keep their families happy. So they were baking bread and making cookies and all kinds of other goodies. And they weren't buying bigger bras. So I was able to see that over and over again. I don't pick it up as much now. So I think it's less of an issue and people have kind of gone back to normalcy. But I wanted to show you the different paired organs. So your wisdom teeth are on that heart and small intestine. So if you had SIBO, small intestinal bowel overgrowth, you had some congenital heart problem, I might find a blockage there that reduces the amount of energy going to those wisdom teeth. Do you know that you could have had wisdom teeth buds that never got enough energy to form, and therefore you're being told you never got wisdom teeth? It's a possibility. We see that. Then you've got the lung and large intestine, and you have to think about things like asthma or mold exposure or smoking or the large intestine and the possibility of some kind of a parasite or gut dysbiosis. And then liver, gallbladder, and eye, anything that can affect the liver. So you're looking at maybe different prescription drugs, even emotions like anger. Then you've got your kidney, your bladder, your ovary, your uterus, the prostate, the adrenals. All of those are on those front teeth that we talked about. So you might only have one kidney. And I can't tell you how many times I don't ask people their health history because I really want to see what shows up on the computer. And I'm going, I only got something on this side. And oddly, it shows up kidney. And they go, wow, that's really weird because I don't have a kidney there. And that's the issue. So it is interesting how you can have a blockage be the organ, and then all of a sudden you start getting decay. Now, what we were told when I was at the dental school going through hygiene was that the only way a person could ever get a cavity is if they didn't know how to brush and floss. So we were supposed to focus on how to clean your teeth. And we did over and over again. Sometimes when a 6-year molar would come in, it wasn't even fully erupted and it already had decay on both of them. We would look at the parent and really fuss at the parent and say, didn't you know that these teeth would come in before they would lose a baby tooth? You need to be in charge and taking care of that child's tooth because they don't have good dexterity to be able to get back there to clean. But once this was brought to me, my paradigm completely shifted. And I started asking parents questions about their child and things that were related to those teeth because I saw that the 2 molars were in on top, but they didn't have decay, only the ones on the bottom. I started asking questions. Does your child have asthma? Do they have maybe a mold exposure? Are they around secondhand smoke? No. Okay, do their bowels move about 30 minutes after each meal? Oh, this is my kid that poops once a week. Okay, that's an issue, but that's not something a dentist can deal with. They would have to refer that person out in order to get that organ functioning better so that the 6 other teeth that would be coming in for this youngster will have enough energy so that they don't come in with decay on them. It's not all about the decay. The teeth that have the thinnest enamel of any of the teeth of those lower front teeth down in the bottom. And it's really not the most common place for a cavity to occur. It's on those molars. So what I want to do now is open it up for anybody that has questions, because I was told to keep this to about 30 minutes. So I've done that, and I'm going to stop sharing here so that I can see people's faces and stuff.
Thank you, Dr. Don. You always have a way to explain things that people like, I don't know what that is. And then at the end, they're like, oh, that's very easy to understand. I know we have a questions in the chat. So read the question and you can answer that. But absolutely, we don't know what we don't know. So when we been exposed to the information, either a patient coming in or we network with a provider and they telling us that this is the technology, this is the knowledge. And the first thing is learn more about it and share that knowledge with the team. Also, I consider every time I see a patient, it's like a gift. They're always telling me what they're practicing, who they're seeing, and I learn so much from them. Okay, perfect. And I'm going to go through the chat and I'm going to ask the questions in here. Dr. Don, questions from Sherry that can this relate to biofilm in the mouth that may create additional bacteria that increase risk to infection?
A good way that it could affect biofilm. Everybody's got biofilm. You've
Everyone.
got good bacteria that's supposed to be there. So don't think that you need to be eradicating all the bacteria in your body or you'll not be healthy at all. Just like we have bifidus and probiotics that we need, there's still good bacteria that's in the mouth. But one way is if you have a blockage in your pancreas, therefore you have some type of a sugar issue. You have higher sugar, you're going to end up with more bacteria because that sugar feeds that bacteria and it becomes a vicious circle.
Yes. And that's the reason why we always ask patients for A1C, not just the fasting glucose. We're also asking for the A1C, which is the 3-month average of your glucose control, but also fasting insulin for a lot of people that say, oh, I don't have diabetes. But the insulin issues show up before the glucose issues. So whenever you go to your doctor and you keep getting you fine and you know that it's not fine because your dentist keeps saying that you have bleeding gum, you have a lot of inflammation, and you are doing water pick and floss and sea salt water and all of these things, and your inflammation is still there, you really need to look into glucose for sugar level. And it's not waiting until you have official confirmations of diabetes. You have to look at fasting insulin and then A1C. And really, Dr. Don always said about the optimal range, but not the normal range. You have a very different way to look at blood work.
Yes. Yeah. And most people don't know this. If you looked at 10 years worth of labs and you had the very same glucose number, let's say it's 89, every one of the labs that you went to would have a different range because what they're required to do is take all of the people that came to that location and they have to add it together and then take an average based on the number of people that came to that lab and take a standard deviation on either side. So every lab has a different set of values. If that lab happens to see a lot of cancer patients or they see a lot of diabetics, then the numbers are going to be skewed. So we never say, oh, based on what the labs say, you look fine because nothing is red and nothing is blue. No, we compare you to a healthy person your age and we look at the number values they got. And if you do that, which is more functional medicine, then you are able to be way more preventative on things and see that you could get better health if you tweaked some things.
Yes. Tessa, I have a question for you, Dr. Don. What is the cost for a Meridian testing assessment appointment that you're doing? And tell them how long does it take too? Because people are thinking like it's a quick scan. It's actually very personalized. You do need x-rays also. So share with us about the Meridian testing appointment.
Yeah. First off, there are only 4 people in the United States that actually use EAV, which is the equipment that I use, electroacupuncture according to both. One in Florida, one in St. Louis, one in Connecticut, and myself. There are a lot of other people who will tell you that they can do it, but either they're not licensed or they've never been trained. So there are only 4 people. Now, are there people that do muscle testing? Dietrich Klinghardt teaches muscle testing
Mhm.
to try to find dental burdens. So yes, there are. But if someone's telling you they're using EAV, I can tell you I haven't trained them. And I'm the person that does the training. So let's get that answered. It takes me about an hour. It doesn't take me an hour to do the test, but after I do the test, I want you to understand not only how I got my readings. So that means I have to explain to you how the technology works because I have tried explaining it before I do the test, and you're like a deer in the headlights. You just sit there and go, okay. But if I do the test on you and then I explain what I did and why it made those sounds and noises, you go, oh, that makes total sense because it will by the time I'm done. You will understand it. So it takes me about an hour. I do require that you have a current x ray, and that is because I need an x ray as you are sitting right there. This is for legal purposes. If you've had a Panorex taken and then you had to have a tooth taken out or you had a tooth filled, I will need adjunctive x-rays so that I have the films as you are sitting right there so that all the documentation is as good as it can be. So that means that you'll be having that done somewhere else, possibly, and then having that test done. Does everybody need the test? No, not everybody needs the test. A lot of times the dentist can see what's going on without having that test. It's interesting though, I have a lot of, remember, I'm the executive director for all the biological dentists. I have a good number of dentists that will look at an x ray and say, I see tooth cavitation. You can't see cavitation. It's like looking at the lamp I just bought at Walmart that has a short in it. Can you see that it has a short? Because if you can, don't bring that lamp home. You can't see it. So the analogy that I give is I'm going to go to a garage sale with a dentist, and sitting on the floor of the garage are 2 flat screen TVs. And we asked the woman selling them, do both of them work? Oh, you know what? My husband told me one of them works and one of them doesn't, but I honestly can't remember which one it is. So the dentist pulls out their portable x ray and they're taking images of these 2 TV sets to see if all the parts are there. While I am looking for the plug and the wall outlet to stick it in to see which one turns on. It is an electrical test. What
It
they
is.
can see in an x ray is if there is less bone. Now, not always, because sometimes gunk fills up. There's fatty tissue that fills up and gives the illusion that the bone is a more normal density. But in a CBCT where they can turn it, they start to get the impression that the bone is thinner. But that would be termed osteopenia or osteoporosis, which most women have had a DEXA scan on their wrist. And if they find out they have osteopenia, then the physician doesn't say, let me dig around in your arm and see if I can burr out that hole and reconnect it. No, no, it might not be a burden. It might be a hole. You actually have holes in your jaw that nerves go through that are supposed to be there. So we try to evaluate. It's like saying, oh my goodness, you have 4 moles on you. But are those moles changing? Are they dark in color? Are they irregularly shaped? Or do we just monitor them? Not every mole needs to be removed on everybody's body. So that to me is the difference between just looking at an x-ray and thinking that you know that electricity can go through and actually testing to see if the
Yeah.
electricity can go through.
Dr. Don, can you share a bit more? Because I know even medical provider and dental professional, when they listen to your lecture, they still cannot imagine that you can do the reading and say this tooth have a low reading, but then The reason you can testing and say it is coming from either the organ or is coming from the tooth itself, or it is having a carie nosal, which is like a tooth that having active caries that getting bigger, or even perionosal, which is a tooth that having gum and bone issues. The reason you can do that because you also knowing what to do to balance it out, to check it out, to know that the body responds to that information.
True, it's like, okay, I'm gonna make it where you understand it. You're at a hotel and you have your key card, but you use it on the door 2 or 3 doors down. It doesn't open. And so you start going to every door because you can't remember your room number. There will be a door that frequency connects with and it unlocks an exact match. It's a key, but in this case, it's a card with a frequency on it, which seems really weird, but it works. That is what I'm doing. It's like the electrician trying to find out, where do I make the hole in the wall where I think this mouse disconnected the wire? They're not just going to come in and cut out your sheetrock at 4 feet up and look at all the wiring, because the homeowner would go crazy. So they use a little ohm meter and they start putting it in every wall outlet on that circuitry. And when they find it worked here, oh, it doesn't work here, now it's between here and here, then they can go in and fix that. So for me, it's going through the system and differentiating between, this tooth has a bad reading, but it's because the braw's too tight, or it's because this person has a problem with the thyroid. And that's where I stop. I don't know what the problem is. I don't know if they're low in iodine. I don't know if they have mercury in the area of the thyroid. I don't know if their thyroid labs are messed up. I don't know if they have an adrenal issue that's causing thyroid problems. I don't know if they just had an MRI with iodine contrast and that blew out the thyroid temporarily. It's not my job. It is my job to tell the dentist, this is something that is a dental issue that is fixable by the dentist. This is an issue that is not fixable by the dentist, and they need to go see their primary care physician.
Yes. And I would like for everyone to know and look for the book called The Healing is Voltage by Jerry Tennant, to understand that our body is not just the blood flow, just not the nerve, just not lymphatic, but we also have electricity. And it's also helping us to heal and to get healthier. And so a lot of time we don't hear it from the medical professional. It doesn't mean that the information is not correct. The next question I saw on the chat is, what city in Texas is your practice located? We are in Katy, Texas. So it's right outside Houston. Dr. Dawn is a part of our team. She's coming from Austin, Texas once a month, 1 week out of the month, and working with us, mostly Meridian assessments and surgery. So when she come in, that's a surgery week for us. And we do taking new patient. There's a little bit of wait, but please just contact the office and we will get you. Actually, today we have a patient came in all the way from Florida, and she's been going to us for the last 7 months, finishing all her treatment, and she's super happy today. So I'm today's a great day for me when I see someone ready for their wedding. So I can't wait to see her wedding photos in November. The next questions, Dr. Dawn, is, are deep cleaning necessary? People always hear when they go to the dentist that I need deep cleaning. And
Okay. Have you ever had a boat? You ever had barnacles that end up on a hull? It's not the best thing. So if you're a boat owner, you're going to have those scraped off every once in a while. A deep cleaning, if there is something stuck on the side of the tooth, think of it as an ingrown toenail. Are you ever going to get that toe to heal if you still have that splinter of the toenail in there? Somebody's going to have to go in and take that out in order for healing to occur. So if they're finding that's the reason and they need to go in and clean that off, more so, I would want to know what pathogens are in there. If your pockets are deeper than 3 millimeters, then there's a good chance that you could have kissed your dog or not washed your hands after you played with the dog's ball and threw it, or any number of things. And maybe you picked up a pathogen that is contributing to maybe bone loss or bleeding gums. Those are easier things to take care of. But a deep cleaning, it shouldn't have to happen multiple times in your life, or we're missing something. We're missing, why are you building up so much? I used to call it tartar calculus on the tooth. Is it because you can't clean that area, or is it that your body is depositing calcium in places? So that could be a nutritional issue. But I'm not going to say no, a deep cleaning would never be warranted, because they are. People don't go to the dentist often. People are not good about flossing, any number of reasons.
It's actually quite opposite that lots of dentists underdiagnose the patient that need the help because the insurance was in the way, or because people don't think that, oh, I have no pain, so I don't need to get that dangerous bacteria, or also because dentists don't do saliva testing. We also have the microscope in the office. The end of the month, when you have our lead hygienist, when she's go over all the assessment we do when you come in for your cleaning visit, the saliva under the microscope, the saliva testing, the pH, the nitric oxide, oxygen level, all of this thing that we're checking on a person to know why their immune systems are not be able to control or manage the bacterial load that they have in the mouth and their saliva. That's when we know that there's more need to be done beside the flossing and the brushing, because everyone thinking like, I'm not doing a good job. Actually, you're doing a good job, but you need to do a better job in different area, or you have to understand your body to personalize that to you. Dr. Don, the next questions, I think that I actually have a lot of patients asking me when they're coming into is actually from Tessa. Are you familiar with Mercedes Tristan? I'm curious if you do the same thing as what she does. Dr. Don, answer the question.
Of course, I'm familiar with Mercedes.
Yes.
Mercedes was a dental assistant in an office where my office was adjacent to Bill Glaris's office. I did train her to do compatibility testing, train her to see when the meridian is reconnected during surgery. Short of that, she doesn't have a license. She has never been trained to test the teeth like I test the teeth. She's a very nice lady. So I'm not going to say anything bad about her, other than I wouldn't trust those readings. And so if you're a dentist and you are trying to depend on you, I will defer to Dr. Katie. When I find something, I am really good about keeping pathology that has come back on what I said, so I can compare. When I find something, it's there. And so when I am teaching offices, I tell them, if you don't have a license, you're not going to be able to do this. But if you have a license, what you need to do is start documenting and keeping the pathology reports that come back, so that you are able to test yourself on how good you are, because you don't know until you start doing this over and over again. And then you start to get an awareness of, okay, I don't understand how I'm doing this, but it's coming back and saying exactly what I said. So that starts to feel good.
Yeah. And I have to say that Dr. Don is absolutely right about it, because not just based on that information from the Meridian assessment, we also look at the pathology and radiology report from the radiologist. And knowing that's what the radiologists see on the imaging, that's what Dr. Don assessments showing, this is what the patient blood work, this is what the patient's medical doctor is concerning about or addressing. So it is a teamwork. It's not a, if you see this reading, you do this. If you're seeing this working out, you take it out. If you're seeing this missing tooth, you place an implant. It's not a cookie cutter, just one size fit all. And this is why we have to understand what the patient is dealing with. Can the body tolerate it? And look at all the numbers, not just the assessment from the Meridian. And so the next question is a bit longer, but I think Dominica asking that I have a tooth that have been retreated at least once due to failed root canal. My dentist say my only option now is to extract that tooth and put an implant. I'm very hesitant. They also found through a 3D scan that there's a holes in my bone directly under a tooth, and no one can explain why. Is there any hope for me? There's always hope. And then I let Dr.
Always.
Dawn answer the
Yeah.
rest of
No,
the.
that's a good question because they took out the nerve. You may not be feeling what's going on in your body, but again, remember your body is designed to try to figure out what to do. This tooth with all the bacteria that is in there, every time you chew, it squishes out that bacteria. And so your body's trying to figure out, should I make a cyst like a balloon and try to encapsulate this bacteria? And if it can't for whatever reason, it starts burring a hole through the bone to try to vent those poisons out. Now, we call it a fistula. If you've already had it retreated once and your dentist is saying that it's failed again, it's probably true. That would be reconnecting the meridian. And then if you have enough good health to deal with on that meridian, you could consider an implant. But there's so many things that need to be questioned. Is that a top tooth? Is there enough length between where the bottom of the bone is and the sinus, or are they going to have to do a sinus lift and do bone augmentation? If that tooth were on a meridian, let's use the meridian of the breast, and you had active breast cancer on that side, it would not be suggested to do anything other than to relieve your body of burdens, which would be taking the tooth out and putting you in a temporary something, whether that's a removable partial, whether that's some kind of a temporary bridge. But we would try to get you to a place where then when you're in remission, we can look at what your other options are. But why would we want to do anything that would diminish even the littlest amount of energy going through to an organ if you're already struggling in that area?
Yeah. And I think the one thing people forget that we always want to test for biocompatibility. And that's what we're using the Meridian assessments for. The EAV is to test to see if your body compatible with the material, not just implant like titaniums or zirconia implant, but also coming down to the anesthetic, the suture, the bonding, the composite,
Yes.
anything that you are going to home with it, we're going to test to make sure that your body is
And
compatible.
this is a good point because some dentists that don't have access to doing compatibility will tell patients, I use things that are biocompatible. I use things that are all natural. I use things that are all organic. That, you know what? That's just not true because you could be allergic to a strawberry. I would be the one saying, oh, but this one's organic, so you can have it. No, if you're allergic to a strawberry, it won't matter whether it's organic or not. So those offices just don't offer that. And it's a way for them to sound like it's okay to not do. If you have a compromised immune system, my suggestion is that you get tested for everything that is going to be used on you. If you're completely healthy and you're not having any problems, I don't really care. Then you're probably not going to be in a biological office because we seem to attract people who are sick and need help. And those are people that we want to make sure we're not putting something in you that reduces your amount of energy or causes diarrhea, God forbid. You had dental work and now you got diarrhea. You think you're going to go back to your dentist and say, oh, Dr. Katie, ever since you put that filling in, I now have diarrhea. No, you're going to be at your MD's office who is going to be doing all kinds of other testing on you and then going, I don't know what's wrong with you. Nobody ever put two and two together to say, could you have just had dental work done? And could you be having an allergic reaction? It's crazy. So that's why we want to cover all our bases on, especially these people with compromised immune systems.
Yes. The next question from Jada. I saw on one of your chart that you had implant could be the reason to cause blockage in the meridian. I have so far 11 procedure done on tooth 16 and number 6. And 6, sorry, 11 procedure done on tooth 16. And then 6 procedure done on tooth 15. And the last one being a bone graft. I'm hesitant to get an implant because finally I feel like my health is going in the right direction, but would prefer to have another tooth to be able to chew on that side. What's your thoughts?
You said so many things. I want to know what's going on that meridian that you would have to have so many procedures done in that area. I'm not personally, this is just me personally, I'm not a fan of bone grafts, especially after COVID. We have questions about even when things are sterilized that the DNA is still there. Yes, we can use different materials other than human cadaver. We can use porcine, we can use bovine, we can even use some things that are synthetic, but it's not what God gave you. So if you have a compromised immune system, again, we're looking at things to relieve burdens, not to add to them. So I'm not sure that I can answer your question without a whole lot more information about you personally. And that's what this all gets down to. It's all very personalized medicine and dentistry. There is no cookie cutter. That's on two different meridians, heart, small intestine, and the thyroid, stomach, spleen, and breast for
On
number
15 and
15.
16. Yeah. And if you still have a healthy 14, and if you don't have 15 and 16, functionally, you are doing okay. And make sure that your teeth are not shifted. Make sure you are not having all the missing teeth that compromise your chewing ability and your function. But again, not every single tooth that out need to be replaced while your health is improving or while you're still struggling. So that leads to the next question from Tamra. She asked, how do tooth implants affect meridians and which type is the best? So we mentioned about implant affect meridian because it's still considered blockage. And which type is the best? I know Dr. Don will say depends on your body. And because we actually see people that can and compatible with titanium, and we see a patient that could not get anything, could not get zirconia implant, could not get titanium implant because their body is not ready for that. And so anything you want to add, Dr. Don,
Yeah,
about this question from Tamara?
just to educate the people that are listening, all titanium contains some nickel. And a lot of women are reacted to nickel. They can't wear inexpensive earrings, and they will tell you right off the bat. Okay, nickel is also a known carcinogen. It is a hapten, so it can trigger autoimmune. So you may not have had scleroderma or lupus or Hashimoto's before you had the implant done. And then afterwards, you start having issues. So I would say titanium's out. In biological world, am I anti-implant? Not at all. I just want to make sure that we have really good communication between the dentist and the physician, because I have seen, and I happened to end up being a patient of Dr. Katie's, but someone who was healthy who went down to Costa Rica and got 12 implants done, 8 of them all on the same meridian. They were all porcelain zirconia implants, and she ended up having health problems. And it was because the dentist blocked completely. Each one of those meridians was like a lane of a freeway. So the analogy that I want to give so that people understand about porcelain, there is a gadget as seen on TV. You buy it, you put it on a lamp, any part of the metal on the lamp, any part of the metal, and then you touch any part of the metal and the light will come. Touch it again, the light will go on, off, on, off. Now move that gadget to the porcelain vase. Nothing will happen. Doesn't matter if you touch the porcelain, doesn't matter if you touch metal. It's non-conductive, so it's not going to make the light turn on. In the case of most of those meridians, short of the eye teeth, your cuspids, and the wisdom teeth, all the rest of them have 8 teeth on meridian. So you think of it as an 8-lane freeway. If I put one implant in, that means I block 12.5% of the energy potentially on that meridian. Okay, but I got all the rest. I put 2 in, now I have 25% block, but I still have 75% going through. If you're healthy, great, go for it. If you're not healthy and you have problems, then you need a physician and a dentist talking about where is the breaking point, and is this going to overburden the fact that this person already has issues on this meridian? Am I able to afford blocking some of the energy going through? Everybody is unique.
Thank you, Dr. Don. And if you've seen in her presentation, something looked like this. We actually printed out really big. And this is also thanks to Dr. Don, not only printed out, she laminated, so we have it in every room for our patient to see. We also have an interactive form, that Meridian chart that we put it on the website. So for those that register for this webinar, you will get a link from us so you can actually get onto that website and enter in the tooth numbers or playing with seeing what meridian the tooth is on. And then that way you can also share and check out what you have and what that connected with. So we will send you the link for the interactive meridian chart. Thanks to Dr. Don, who created the chart. And everyone that come into our office always want a copy of it, want to take a picture of it, want to share that. So thank you. And we will send you the link if you register for this webinar, and we have your information on the system. And so we send it out for you first thing tomorrow morning. And Dr. Don, I know your time is super valuable. Thank you. Answer. There's more questions, and please message us. That's how you register for this webinar. And message us so we can answer more questions and connect you. And always checking out the IABDM.org. And that's our organizations. And we not only training the professional to take care of the patient, but we're also guiding patients to make the right choices for themselves and find the right provider can take care of themselves. And so thank you, Dr. Don, for joining us on the webinar tonight. Yes, and next week, we actually have a doctor that also trained by Dr. Don on the Meridian, but he's not going to talk about the Meridian. He actually our orthodontist, and he's going to talk about airway, because I've seen a lot of questions coming through to our texting and our emails about airway expansion, not only for children, but also for adult, sleep apnea, and all that related to orthodontics. So that will be next Wednesday, 6 p.m. Central. And thank you, everyone, for staying the whole time, engaging, asking questions. And please follow the IBDM on Instagram. It's DIABDM on Instagram, and check out the website. And Dr. Don, thank you again for your service. And please connect with us on social, and see everyone next week on Wednesday at another webinar on the topic of orthodontics. Good night, everyone.